Hi, Lisa.
Hello, how are you?
Very good, thanks. It's a pleasure to meet you as well.
It's nice to meet you. And I'm not really familiar with Teams. I use Zoom every day, so I don't know how to help or
Same, same. Likewise here as well. I usually use Zoom, and I don't know why my video is flickering, but I hope
But you've
everything is
got a
okay.
lovely smile, and that's nice. But so I'll just say hello because we've got Mujir, we've got Zahia, hello, Hiba, Zapnag, Zinab. So that it looks like we've got a few. Oh, you can hear me. Hi, Majid. Hello, love. Aisha,
Hi.
Sapnag. Now, I found there was a screen, there was an icon of a microphone on my screen, and you have to unclick that. It might have a cross on it, Sapnag. If this doesn't work, we can do it another day on Zoom, perhaps. All right.
Yeah.
Okay. Right. So, okay, so we've got so a few people now join. It's perfect. Oh, well, I'm very pleased. Hello, Amal. Big love and kisses to Amal, the mother of the Hope Centre.
I can see. Our principal Lisa here is very excited and ready to go.
I am ready to go. I am. The participants' mic has been disabled, which is okay. We can hear you. Okay, Majid, brilliant.
Perfect.
Address me as Sapna. Okay, all right. Apologies. I have the worst kind of ability to get different names that aren't things like John and Sarah. I taught in the UK for 25 years before coming here, and of course all the children were always called John or Sarah, so it was easy. So I'm learning new names. Right.
Wow, that's
Okay.
definitely.
So
I'm sure. Yeah.
lovely. Okay. So shall we make a little start with a few questions?
I think might need to check with the organizers, see if everyone is here already, because I think there are more than the attendees here today. So let me check with them, see if.
Well, whilst we can we
Yeah.
just tell me a bit about you? Because I mean, this is my first time to meet you. So tell me about your work.
Well, hi, my name is Hang. I am a board certified behavior analyst and also a qualified behavior analyst. I'm from Malaysia, by the way. So if anyone
Oh,
interested to know where I'm from, so I've been in the field working with special needs and also intellectual disabilities in for about 8 years now, more than 8 years. And I first started in the UK, and also I worked in the North Wales back then. So that was where I
cold.
started my career.
That was cold.
Cold and rainy.
Yeah, yeah.
And yeah, that was where I started. And then after that, I practiced myself in Dubai. I work for a few clinic centers now, and I was the head of department, head of ABA department in one of the autism blocks. Not sure everyone is familiar with that. Um, and then now I'm currently working as a BCBA consultant, providing consultations for clinics and also families in terms of providing programming, designing programs for special needs. So that's a little bit of my background here. What about you, Principal Lisa? We have.
Oh, well, I'll tell you a bit about me. So, when I started working with children and families 31 years ago, and I trained as a nanny, and but I had an interesting start really because I wanted to work with families who were facing challenges right from the start. It wasn't about working with affluent families for me. It was about seeing what I could do in the community. So my very first job as a qualified nursery nurse nanny was I set up a creche and a centre within a drug and alcohol centre where families were coming for counselling, and I just felt that we needed to do something to help the children. So I've been working kind of in community work for 31 years. I then went on to be a teacher, and again, my heart wanted to work with children with additional needs. So most of the children that I've worked with have had to face some kind of challenge, and then I went on to become a principal, and now I work privately. I now work from home, and I work with people in their homes. I work on things like potty training, sleep training, behaviour, and just generally coming alongside a family. I think that would be the best way to describe what I love
Yeah.
to do. Yeah.
Wow, that's actually what a lot of family needs as well. Because sometimes, children's development is actually one of the big thing, especially as a parent. And
Oh my
and
gosh.
for me, I'm just recently become a parent myself, so I can
Oh,
relate a little.
congratulations.
Thank
How
you, thank you.
nice.
Yeah, thank you very much. So I started to realize that it's actually one of the top main concerns for every parents to make sure their childs are growing healthy and making sure they, day-to-day life, they can function and to be independent as well. So I think this is actually one of the big concern for all parents as well.
Yeah.
So
And do you know
definitely.
what? It's not easy being a family, being a parent. And I've worked with the most vulnerable families in society. And, there's a lot of judgment made about families. And within every family, there's love. And with every family, there are people trying to make the best with what they've got and do the best that they can. Um, so everyone's different, aren't they? So Amal said hi. So shall we have our chat now about are we ready, Michelle?
Yeah, are we
Yeah.
ready?
Okay. All right. How do you feel that your work could support a family, Hong, in relation to toilet learning? Is there a connection between ABA and toilet learning, do you feel?
Yeah, so just in order to give a little bit about how ABA can relate to the toilet training, I'll just give a very brief summary about what is ABA doing as well. So ABA stands for Applied Behavior Analysis. It's actually a practical way of how, a practical interventions that involve a systematic change on relationship on the environment and the behavior. So most of the time, our behavior is actually triggered by the environment, and how is our behavior maintained in the environment is also a big portion of that. Now, so toilet training, if you look at perspective of the behavior of, you know, uh, having accidents, for examples, or going to the toilet, really the whole process is a behavioral process, like engaging certain behavior, step one, step two, step three, step four, step five. So all these are very related to behavior and how we can promote the right behavior to go to toilet. So yeah, in terms of that relevance, so applied behavior analysis is actually quite useful and practical to teach independence for toilet training.
That's interesting because one of the things that I think is most important about toilet learning is about children making the connection themselves. I'm not a fan of Skinner and his behaviorist approach of where you do something and I give you a reward, because I feel it delays that connection. And we need children to connect with, well, I feel this sensation, therefore my behavior response is that. We need them to make that connection. And often what goes wrong with a lot of toilet learning is the adults are toilet learned, but the child is, I don't really know what's going on, but my mum just keeps putting me on the toilet every 30 minutes. How do you find with your work a way to get children to make that connection, Hong?
So, okay, this is very interesting. So, connections, the urgeness of going to toilets, this is one of the main things that we want to work on. Now, it really is applied behavior analysis. We focus on following or contrived motivations. In fact, the connections that you mentioned just now is exactly the motivations to go to toilet. And and no doubt, when early stage about ABA, the skin also focus on observable behavior, but also later on, we want to take into account the private events as well. Sometimes it's hard to see that, but the motivations to go to toilet is exactly what we look out for. Now, sometimes when kids want to go to toilets, there are certain signs that will demonstrate uh, the like pre signs that they need to go to toilet. For example, the fidgetings, and those are the signs that we're looking for, and the, that is associated to the connection you mentioned about the urgeness of I need to go toilet now. So it's exactly exhibited not just the private internally, also externally as well.
Mm.
So using those connections, then we teach them to go to toilet by basically you have the urgeness. We go to toilet. You had the toilet process, and then you're being reinforced by the process itself, which means you release the urgeness, and therefore you feel much comfortable. So
That's the thing. And you
yeah.
see, if we then weighed in with a sticker and an M&M, I feel we almost miss that opportunity for them to make their own connection, which is why I don't use rewards. And it's quite controversial, really, because most people that are passionate about toilet training, in fact, I don't know anybody in the kind of, there's a lot of toilet trainers in America and they all use sticker charts and rewards and things. But I feel that might be where things go wrong a bit sometimes with toilet learning. What do you think?
Well, if let's say everyone is gonna follow the commonly used like the sticker chart and certain rewards, M&Ms and stuff, uh, well, to be honest, is that there are actually more than that. So in order to go to toilet training, you have to arrange the environment in such that they are ready to go to toilet. Now, first thing first, there are people who will be like, for example, making the toilet as a place that you need to sit down in the toilet. You need to sit in the toilet for 5 minutes
Yeah,
and stuff.
yeah.
And that is aversive to the child, really.
Yes, but you see, I get messages from, and I just say hello to
Yeah.
everybody whilst we're chatting. If you've joined late, we send you our love and put your questions in. And Mal's put some questions here we're going to answer. All right, we're here for you today. That I get messages from mummies and they're like, oh my God, what should I do? My child's arching their back, okay, and screaming and their body's going rigid. Well, unless you've got 15 pairs of hands, you're not going to be able to squash the middle of their body to get it to go to sitting position. I mean, you'd be wriggling with an octopus here.
Yeah.
It's not going to work. Actually, someone's asked a really interesting question. The potty training watches. I sometimes use them, sometimes I don't. They can actually be quite upsetting, particularly for children with any sensory issues or for whom autism may be a factor because it really bothers them, the potty training watch. But there are a few children it can work with. Hong, have you got much experience with the potty training watch?
Not very much.
No, sometimes it can work if somebody else wears it, but most children I know, particularly the kind of children that we're talking about here, don't like the sensation of it on their wrist. They're like, oh, get it off, get it off, get it off, and then you've spent 300 dirhams on something.
And that's actually quite normal in terms of that because children with autism and special needs they don't like to have something on their body sometimes for some children, and that's
Yeah,
something additionally that we need to teach as well in order to make them feel comfortable about that.
yeah. I mean, the potty watch there's a nice verbal cue in a potty watch. There's one that's a monkey and it goes, come on, everybody, it's potty time. Okay. And some kids quite like that, and there are some songs that link it with, but it's you have to be a bit careful because if you start strapping on a potty watch, to a child who might not be, aligned with the process, it can make it a bit worse. But so one of the questions here is, my son is 3 years old, no obvious delays. He still wets the bed. What would the reason be? Well, my darling, is that we've got about 3 factors which impact nighttime toilet training, and they're not the same factors that impact daytime toilet training. In fact, about 20% of children who are 5 still wet the bed. So if your little one is still struggling with nighttime, well, not even struggling, if your little one still needs support at nighttime with their toileting, it doesn't mean that there's anything wrong. In fact, developmentally, they're on track. Many of the children I work with are usually starting to shift from nappies around about between the 3.5 to 4.5 is the most popular range for children to be dry at night. So don't worry, mummy. What would you say, Mr. Hong?
Yeah, I agree as well. So toilet training definitely has divided to two parts, the morning and the night, because it's entirely different. And on top of that, there's one thing that the key element that we when we start the toilet training is the diapers. So, and some parents might ask, but what if he has accidents and should we not remove the diapers, or should we remove the diapers, or should we put the diapers on? But truly is when you first started the toilet training, we should really start remove the diapers, because we want to start telling the child that you no longer can just uh, having a pee or even others number two in the pants. So that is where we really need to start remove the diapers the moment we start the toilet training.
Well, we've got to be really clear about it. I mean, I will often get messages from mummies that say, oh, the toilet training is just not going very well. We're doing half the day with a diaper and half the day not with a diaper, and I understand why, because, it's a big step, but it's really confusing. So how can we access your services? Well, you can obviously access Mr. Hong at the Hope Centre. If you're interested in working with me, you can message me on Instagram. I talk to families all day, every day. I'm happy to chat to you. So get in touch with me. I work with families on Zoom and in the home. So we have, can I ask you, let's ask you this question, Mr. Hong. My child has speech delay. Is this the factor that is impacting his toilet training?
Well, verbal, as in like non-verbal, basically, right? So, well, being able to actually verbalize what you want and your needs is definitely an advantage, but it's not the major component. I would say it wouldn't affect the toilet training if your child is non-verbal. In fact, the primary goal that we should have is whether your child has a mode of communication in the first place. Okay, so sometimes children can be trained on using PACs, for example, to communicate they need to go to the toilet. They can use AAC device to indicate that they want to go to the toilet. So it still really is down to one main thing, is whether they have the mode of communication, functional communications. If they don't have that, I think we should start with that first. And then once they have that, then it's easier for them to communicate what they need to go.
No, I agree with everything you said, Mr. Hong. However, I train families on something called elimination communication, which is where we don't use nappies with babies. And through this work, I've learned a lot about that we can anticipate and get into the patterns of when children are toilet learning. And so with some children who are non-neurotypical or physically challenged, you can anticipate their toilet needs, and there can be some element of toilet learning where they're out of nappies, because you can read the signals and the signs, and you can toilet them at the right times. There is that has come in, but I see what you're saying. It's just that I have managed to toilet train some children who really are not communicative at all. And it is possible, but it's obviously going to take a lot of watching and observation, I think. Sorry, just want to ask her. Zainab said, but you did not mention what age do you encourage with. Zainab, this is actually a very short workshop today, and it's not focusing on kind of when to start. It's going to be talking about some of the wider issues around toilet learning with children with additional needs. If you want to have more of that type of when should I start toilet training, I would get in touch with me, because I'll be delivering a free workshop that's sponsored by NUC in January on that, which is like a baby's brand. You can come along to that. Okay, so we've got Mr. Hong. My child is 6 years old. Has CP, speech delays. We do the routine method, but he still hasn't made the connection. So this is what I was talking about. He started taking off his nappy at school and at home, but he still does not say when he needs to go. Sometimes he says before, but never before. Would ABA work for CP kids? What is your thought, Mr. Hong?
So yeah, I was just reading about the comments there. So my child is 6 years old, has CP and has speech delays. We do the routine methods, but he still hasn't made the connections. He started taking off his nappy at school, at home, but he still doesn't say when he needs to go. Sometimes he says after, but never before. So first of all, it's when you do the routine methods, first of all, you want to analyze is that how rigid the routine methods. So for example, if you stay for 30 minutes, every 30 minutes you're going to bring your child to the toilet. Now, is there a plan to fade out the routine, the schedule? That's number one that you want to think about. So if let's say there's no plan to fade out, so that's where you need to start first. So plan how do you want to fade out your routines so that you start to not rely on specifically schedule whenever he needs to go to the toilet. And then secondly, once you take it off the nappy and stuff, that he doesn't say when he needs to go to the toilet. So this is where it relies on the initiations already. So when you fade out the routines, the next goal is to teach initiations. Now, sometimes, a lot of times, we might ask our child, do you want to go to the toilet?
Yes.
Should we go to the toilet? Now,
and they all say no, don't they?
either they say no, or they just ignore that, or you just bring him to toilets. So now it creates, what happened is that it creates a dependency on that, like the vocal prompt. Now you realize on, oh, I have to actually rely on someone to ask me whether I need to go to toilet first, then I will go to toilet. So it becomes the dependency on the prompts, on those things, and therefore you will see that there's no self-initiations in the toileting. So therefore, in order to teach the initiations, one, you have to fade out the routine so that he start not having accidents. And then secondly, try to kind of like, bring him around. Don't say anything. Just see if he goes to toilet. When he does that, praise him a lot. Reinforce that behavior. So that is what I would suggest. But again, like what Lisa said, it's gonna be like a lot of steps to process. So we need to really break it down. But today the workshop is it's a short overview, I would say.
Yeah. Do you know, and the thing is we've never met Mr. Hong, and it's interesting that we are so aligned. You know, it is very interesting. And Mal, parent question: my child only wets at night, no accidents during the day. What can I do? Well, there are three factors really towards night training. So mummy hasn't said how old their child is there, but look, let's think about why is a child dry at night? Well, one of the things is bladder control. So we do need an element of development in the bladder control. So with a physically typical child, you would expect them to be able to have the bladder control of about 250 mils at age 3. So that sounds like a lot, but it isn't really, because if you've gone to bed with a full bladder, then and it's more than 250 mils, you're not going to be able to hold that all night. So there's bladder control, which is a factor. There's also the factor of, are they producing vasopressin secretion, which is the antidiuretic hormone? Is there an element of arousability? Now, if your child is very, very, the old saying, sleep like a baby, well, that's true. It's because there is low arousability for very small babies and toddlers, and as they grow up, they are more able to be aroused and woken during their sleep. I know you think, well, my baby wakes up when I turn, the Hoover on or whatever, but so you need that, and so your child also needs to know what your expectation is. So one of the things you could think about doing is, does your child know whether they're allowed to get out of bed to go to the toilet if they feel the sensation? Or do they need to call for you? There are quite a lot of factors, and I coach families on nighttime training, usually only in about 45 minutes. I've spoken to them and helped them with that. There are a few factors to this, but one thing is really clear, is you can't use a reward system for nighttime toilet training because it's very, very physical. The promise of a big pancake in the morning isn't going to do the job. What are your thoughts on?
I actually agree what Principal Lisa was you were mentioning about those things. Yeah, at night the arousability is definitely different from the day, and in fact we always will first start to focus on the toilet training in the morning first to enhance the successful rates, so that the child are more likely to be able to go toilet by themselves. Now, on top of that, there's another thing that I also would like to mention on this, is that sometimes you will see that especially for children with special needs, they would, there are times they would just stand out and start to walk out the room. Now, one thing as a parent is that you want to keep in mind, do not try to block them just because if they need to go somewhere else. Who knows? There are times that they actually want to initiate to go to toilets, and that was the opportunity that he can go to the toilet by themselves. If we block that, they just lose one opportunity to initiate.
Okay, so what are the general guidelines? Okay, so Ma was saying that her child's at 8.5. Now, a child of 8.5 would, in my opinion, would need to be seeing a pediatric urologist. If they're still wetting at night and there are no other impacting conditions at 8.5, I would expect to see that child able to be dry at night. If they're not, then it does need exploration. Most pediatric urologists are not keen to wade in with any tests until the child's 6 or 7, but 8.5, they definitely would. How do you balance potty training at home and school? Kids' routine is different and they cannot go every 30 minutes. Well, I wouldn't recommend you take a child every 30 minutes to the toilet anyway.
I agree with this. Start off with that first, and again go back to the same like fading out the routines, and that will actually help, right?
Yeah. Yeah.
So I agree with that too. Yeah.
Yeah. She's non-verbal and a genetic syndrome. Okay.
Okay.
I feel that I wouldn't be the right person to comment on the physicality elements of her still wetting at night at 8.5. I do think you need to talk to your team to see what is the best approach to take there, Marwa. But I send you my love and best wishes. Oh, new message. What have we got? Yeah. Oh, thank you. You're so welcome. They go to a special needs school and they do not have the support to take the children every 30 minutes, unfortunately. Yes, but what Hong and I are both saying is that actually to really succeed with toilet learning, we don't want to be taking them every 30 minutes. We do need to give these children some space. Otherwise we get resistance, and we certainly don't get initiation if we're on them every 30 minutes. I mean, could you imagine what that would feel like if I said to you, right, up, quick, toilet, wash your hands, sit on this plastic pot, come on, go.
Yeah.
You wouldn't want to do it, would you?
And I think the routine is only begin to like what Principal Lisa was saying, talking about the connection. So the routine is just actually establish the connections for now, but essentially it needs to be fade out. So
yeah, and the thing is and parents will now be sitting here thinking, well, hold on, well, you've told us we're not taking every 30 minutes, you've told us we're not going to necessarily use rewards. Well, what is it that we're actually going to do? And there is no, I can't say to you, do this and this and this, and if you do that, it's all going to be fixed. Because I think Hong and I would both agree is that we work in a really bespoke way with each child. And every single child is going to need something different. And so the answer to the alternative of every 30 minutes rewards, all of those things that we think we need to do with toilet learning, the real answer is we have to get really curious. We have to get really curious. We have to listen. We have to help that child to make connections. We have to go slowly, supporting and to guide them through. But it's 100% possible for many children. And over the years, I've worked and toilet trained children with all kinds of different challenges. What elements are needed to say that a special needs child can be trained? I personally thought that it's always not an option. Love that question. I love that question too. What elements are needed to say that a special needs? That is a really big question. I've got some ideas, but I talk too much, so I'm going to let Hong answer it as well. What are your thoughts about that question? I like that question too.
I actually trying to get the questions because I cannot look at for some reasons I cannot access to the comment section. That's
fine.
why.
Okay, that's okay. So one of the questions is, what elements are needed
Okay.
to say, to believe that a child with additional needs can be toilet trained. So what are the factors that might give this mother some hope?
Okay. First of all, yeah, toilet training, if you look at that from the behavioral perspective, then yes, every child can be toilet trained. So it's just that in the exceptions of the medical conditions, we have to rule out the medical condition first. And then technically, yes, we have to be toilet, every child actually can be toilet trained. Now, the only thing is that we need to do is when are we going to start toilet training? So a lot of questions actually posed by the parents to me is that I don't think he's ready for the toilet training yet, or maybe we should do it next year. Maybe we should do it, yeah. So I think the question is when are we going to start toilet training? Of course, if you ask me, I would say as soon as possible, because some children actually get toilet train concept really fast. Some children takes a little bit longer. So I work with a lot of children specialists as well on the toilet training, and
I would encourage, I mean, I literally just want to encourage you. I don't know you or what your situation is and why you've asked that question, Mummy, is just encourage you. I mean, I toilet trained a little boy in the summer who was totally non-verbal, and who was on the autistic spectrum. He also was fed through a tube. We had this little boy was really facing some significant challenges, and he was toilet trained. We did have to go about it in a very unusual way, but we got there, and he is doing really well. Mummy's messaged me, just give a number, why is it left so unclear?
what is that?
Okay, we're just going to give you a number. What is the number that you want? When you should start toilet learning? Well, okay, let's think of a number. It's going to be around something starting around about 18 months through to kind of 4 would be the average age that you would expect children. We know that a physically typical child will begin to make connections between their bladder and their bowel, around about 18 months. They start to make physical connections, okay? I'm sorry that you're getting a bit frustrated, but I'd just like to say I'm giving my time for free today. You know, I'm just here to help, Mum. And you can get in touch with me privately if you've got some nice questions.
Well, I agree with that too as well. Just make sure if you talk about the numbers, it's all about the motor coordinations and also the physical part as well. So whatever Lisa says is actually making sense. Yeah.
Yes, and you know, look, if it would be like this, think about it in a different way. It would be like us saying, right, I want to know, when is my child going to walk?
You're not going to say in 5 months time, sorry, in a 5 months old baby. So most likely not, right? So, yeah.
It's going to be about anything between 10 months, 18 months, anything in there. And then of course, you've got various degrees of that learning to walk. You know, please can we contact, of course you can get in touch with me. I'll just put, here's my number, but 97152 760 The thing is here is, look, it's really frustrating for parents actually, and this is why I do so much toilet learning, is because parents are lost. You know, you Google toilet training. If we were going to Google it now, in fact, most of the information that we would find would be really misleading and conflicting. Do you agree? It's not easy. No wonder you feel frustrated.
Yes, I agree, Lisa, as well. But again, there are some points that the information, if you Google now, I'm sure you will find Austrian, actually a toilet training by Austrian and some other general toilet training. They will talk about step by step of how you do toilet training. However, like what Lisa was saying, every child is different. So every child is different. So therefore, the toilet training should be personalized and customized to the child specifically themselves. On top of that, one thing to keep in mind is that there are certain procedures that people will use when your child has accidents. Have you ever talked about if your child has accidents, what would you do about that?
Mm.
So Lisa, what would you do about that if, let's say, your child has an accident?
I actually embrace accidents.
Mhm.
I see accidents as learning opportunities for you and the child. That's when you can get curious. Okay, well, what happened before? Has this happened at the same time yesterday? What was the situation? What could I do differently? What could they do differently? I see accidents as an amazing opportunity to think through what to do next. What's your thoughts, Hong?
I agree as well. One thing in mind is that some people may suggest that use punishment procedures, like basically,
Oh,
oh, don't worry. This is where I want to clarify this. Okay, do not use that because your toileting process should be fun from beginning until the end. If you use the punishment procedures, it in fact will give you a counter effect where now your child will not doesn't want to go to toilets. That's number one. And secondly, we may accidentally give more attention than it should be because sometimes we don't want to reinforce that excellent behavior, right? So you want to just keep it chill. Oh, just have excellent, that's fine. We just have to redo it, the whole toileting process again.
I
So
say something like, for children that, can process language, I say something like, oh, I see. Okay, so
yeah,
we've got pee pee on the floor. Oh, what happened there? What could we do differently? Where is your potty? You know, shall we clear it up together? Supportive, understanding, helping them to make connections. But what happens is children might have an accident and then the adults go, oh, 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 oh.
yeah,
And of
I
course,
agree. The reaction is like,
this
oh,
that
messy.
actually reinforces the behaviour to happen again. But we are coming to the end of our time. We have actually well gone over our time, but
Yeah.
Samir's asked a question. What was it, Samir? Let me find it. Yeah, Samir said our son was potty trained before when we were stuck at home during COVID times. He was 3. As soon as he started going to nursery again, he lost that skill, and now he's back to his diapers. He's 4.5 now, and he has very limited verbal ability. Any tips to get him started? I mean, he was obviously doing quite well when he was at home, and he can still do very well at home, but yes, you've obviously now got nursery, and at 4.5, I imagine he's now going to school. I mean, I would love to work with you and help you, as I'm sure, Hong would. But I think we've got to almost go back, really. If he's in diapers, we've got to go right back to the beginning.
Exactly. You have to restart the whole thing again. I
Yeah.
agree. Yeah.
And that's okay. That's okay. We all sometimes have to go back to the beginning and, start things again. But you'll get there. Just keep going. Don't give up. Yeah.
Agree.
Right. Okay. So, thank you. Got to go now. Well, goodbye, Majid. Thank you,
Thank
Samir.
you.
All right. Well, Mr. Hong, it's a pleasure.
It's
I
a
can
pleasure
see
as well.
you've got so much passion for children. I can see that. It's wonderful.
That same goes to you as well. I like the way how you present it and encourage. I think this is the most important thing. Toilet training shouldn't be any aversive. It should be fun. So I'm glad that we actually had a talk today with you as well.
Yes,
So
I think
quite
we're very,
inspiring.
very aligned. We're very, very aligned on this, and so
Yeah.
it makes me feel like I'm on the right track.
Good, good. It makes me feel the same as well.
Good, thank you. And I don't know if you know, but I've been a big fan of the Hope Centre for 4 years since it opened.
Good.
Yes, when I was the principal, you used to come into my school, and I always recommend the Hope Centre, and I'm a big fan of Amal, and of course Dara.
Yeah, and Amma really did, extend herself to help as many children as possible. So,
Yeah.
yeah.
Yeah,
So
and you do. And the thing is, the Hope Centre does it with so much authenticity that I think is really valuable. In a country where where you can't access free medical care and support for your children with additional needs, you do need to know that you're using a centre that's got integrity, towards families. I think that's vital, and I've always found that to be the case at Hope. So anyway, right.
Thanks for the
Lots
impression.
of love to everybody. See you guys soon. Good luck with fatherhood.
And thank you. Good
See you.
to meet
Bye,
you as
Mel.
well, Lisa.
Bye.
Take
Bye.
care. Bye.